Tell us, how are hospitals profiting off COVID?
The one that we had discussed together is the fact that a lot of hospitals are using a new model called hospital at home. And those of you that don't understand what that is hospitals go through a process of receiving a waiver from Medicare, etc., that allows them to send patients that should be admitted to the hospital but are stable enough to go home to go home. They can go home with oxygen. They'll have a nurse visit them. There's certain things that have to happen within 24 hours for the hospital to qualify for this. The interesting thing is even though you're at home in your own bed, the hospital gets to bill insurance and get paid as if you were in the hospital. So they, on average, save 30 to 33% because they don't have the cost of brick and mortar for you being a patient.
And do they get reimbursed by these insurance companies, including Medicare, the same rate as they would in the hospital?
That's a good question. Yes. You actually, when you bill the insurance, you bill it the exact same way that you would if the patient was in the hospital, meaning same dollar amount, same numbers and codes, and they get paid exactly the same.
And they're not using the hospital bed. They're not using the hospital sheets. They're not using the hospital's toothbrush. They're not using any of that stuff whatsoever.
So, and that's where I said the 30%.
Right.
The 30% comes in. Yeah.
Right. So the hospital is literally saving 33% is what you said, yet they're getting paid the same. So again, the hospitals are ripping off the system as they are so good at doing.